Yeah, so today we're talking about brain injuries caused by medical malpractice. What types of medical care might, eventually lead to brain damage in the case of a malpractice case?
Well, anytime that there's any kind of loss of oxygen to the brain, usually when the person, loses consciousness. So this happens a lot in the emergency room, when, patients stop breathing, which doesn't get noticed, or, takes them too long to intubate the patient and get them breathing again. Those can cause brain injuries. Person might go in, their heart might stop beating, they failed to recognize signs and symptoms of a heart attack until it's too late, till the patient's heart stops beating. Once the heart stops beating, they're not getting enough blood and oxygen to the brain. That can cause a brain injury. It can happen during anesthesia. So essentially, it can happen anywhere in the hospital, anytime a patient um, stops breathing or their heart stops beating. So, like in the intensive care units, if patients aren't watched closely, patients can stop breathing, heart stop beating. The nurses don't notice it right away. Um, and, an adult, if they go 3 or 4 minutes without oxygen, the cells in their brain start dying, and that's brain injury. So after 3 or 4 minutes, the longer that goes on, um, the more cells die, the more damage there are. So if say, for example, in the ICU, if the nurse doesn't notice, patients stop breathing, for 10 minutes, and then it takes them, 2 or 3 minutes to get the patient intubated and breathing again, that person's gone almost 15 minutes without oxygen. That's going to be a substantial brain.
So a lot of brain injury symptoms can be kind of subtle, and hard to detect. Are there signs that someone should look for to help identify a potential medical malpractice type of brain injury that might have occurred, versus maybe like when somebody's recovering from surgery, they might be a little groggy or a little out of it or something like that to, at the beginning, and it's just part of the normal recovery process. But, what are the signs maybe that somebody should look for that there's been some sort of significant damage done?
Well, really, any kind of unusual behavior, that anesthesia is going to wear off after, 8 to 12 hours. You're not really going to have any residual anesthesia left. So if you're still having any kind of symptoms, and to your point, a lot of these are subtle. A lot of them might not be noticed, but I mean, if to somebody in your family, any kind of abnormal or strange, so any kind of behavior that's not typical for that person, even something as simple as they forget certain words or have trouble putting thoughts together. I mean, that's a sign of a brain injury. So yeah, they can be very subtle. So if you notice any kind of changes, it's definitely worth consulting with a medical malpractice attorney, uh, because that medical technology now can detect brain injuries, um, even very subtle brain injuries, through MRIs, especially special kinds of MRIs. There's actually different centers. There's one in Detroit, for example, where I don't claim to know all the science involved in the technology, but the doctor up there can detect even very small, minor injuries to the brain that resulted from a lack of oxygen.
And brain injuries often, have lifelong consequences because it doesn't, you're not necessarily going to recover from that or have the brain kind of, heal itself to its fullest ability. What types of damages are considered when you're building a case for a brain injury caused by medical malpractice?
Yeah, well, in brain injury cases, you're exactly right. The brain doesn't heal itself, so once it's injured, it's it, you know, the person may be able to compensate in some situations, but in most cases, it's going to require um, future medical care, future medical treatment, aids and devices that will help the person in, do their normal activities. So the biggest harm or loss in those cases is the cost of that care, And in those cases, we always consult. Our job as a lawyer is to try to put the person, back to their lifestyle as closely as possible, but have them engage in the same activities they were engaged in before the brain injury. So we work with experts in the field to put together a life care plan, which addresses all their future needs, what aids they would need to return to their former lifestyle. And our job would be to obtain, whatever that's going to cost, whatever that number is, to obtain that as compensation for our client, so that they could, as close as they can, with return to their normal activities and their normal life, their former lifestyle.
Can you walk us through a typical brain injury, malpractice case from the time when the person, notices that there's a problem and they maybe contact an attorney, a medical malpractice attorney like yourself, to the point at which hopefully they're, there's a verdict and they're getting damages recovered. What's the whole process of the case there?
Well, sure. I mean, first we meet with the clients and their family. Find out what happened, find out what the person's life was like before this injury, what it's like now. The next step after that is to get the medical records, and that's a process to get the medical records, get complete medical records. And in most cases, we need medical records not just from when the injury happened, but if there's any, if there were any prior medical conditions, we need to know what those are, and any records from any care that's happened, as a result of the injuries. After that, then we would, we always review the records ourselves. We have a RN on staff here full time, so she goes through the records. I'm not a doctor. I don't have any medical training, but I've been doing this for 40 years, so I kind of have a good handle on medical records. So I look through them and see if I think there's anything that was done wrong, or at least suspicious for that. And if the nurse and I believe there's a reason to go forward, then we have to consult with outside medical experts. And we have, having done this for 40 years, we have experts pretty much in every field that we can consult with, that we know will, be candid with us one way or the other. If there's nothing wrong was done, they'll tell us that. If there is something wrong was done, they'll tell us that too. Then, we can't file a case without having an expert sign an affidavit to say that there was negligence and the negligence caused an injury. We file suit, and then the next step would be to have a question and answer session, which is a deposition. It's called a deposition, where we just question all the caregivers involved to find out, why they did what they did, why they didn't do what they should have done, and find out what their story is. Then they'll want to the other side, the defense, will want to talk to our clients as well, find out what their version of the events is, and then after that, the experts from both sides will get deposed, and then we prepare. Then we get ready for trial. And basically, when we try a case, our approach is, we always try to show, what should have happened, what safeguards should have been in place to prevent the injury. Mostly those are hospital policies, protocols, or professional guidelines, and then how those were violated, why the safeguards were ignored, guidelines weren't followed, protocols weren't followed, why what happened. And then, what the harms and losses to our client has been as a result of the injury and the failure to follow normal protocols and safeguards. Normally, most of our cases do settle. They settle right before trial. But if they don't, we try a lot of cases, and we get a verdict for our client.